The family of a Vancouver woman forced to transfer hospitals before being able to get medically assisted death is suing the hospital operator that wouldn't let her have it.
She just wanted to die with dignity. For her to arrive at dying by MAID wasn't something that she wanted to do at 34 years old.
Samantha O'Neill was diagnosed with terminal cancer in 2022. She wanted medical assistance in dying, and she didn't get it. O'Neill was in St. Paul's Hospital, which is run by Providence Health Care, which opposes MAID on religious grounds. She was heavily sedated and placed on a commode for a transfer to another facility. O'Neill's parents argue her charter rights were violated. Providence says it's reviewing the lawsuit. The province of BC is also named in that suit. Premier David Eby says he respects the parents' right to go to court. Joining me now are Sam's parents, Gay and Jim O'Neill, as well as Dr. Jyoti Jayaraman. She is a Vancouver-based palliative care doctor who quit over Providence's policies. She's also a plaintiff in this case. Thank you all for making the time to speak with us here on Canada Tonight. Jim and Gay, I'll start with you. And maybe, Gay, you can start us off here. Take me back to that day that Sam passed away last year and what that day was like.
Well, it was probably the hardest day of our lives. We arrived at the hospital. We knew she'd chosen to die by MAID. They phoned us that morning and we arrived. There was a lot of us. There was Jim and me and Sydney and Ben. That's our other two kids, a little bit younger than Sam. Cousins, friends, her aunt. We arrived at the hospital and she was sitting on her bed with one eye closed, emailing madly to her friends. She was emailing goodbyes to her friends. And that was really hard. And we spoke for a few minutes. And she was eating peanut butter out of one of those little containers because she was vegan and peanut butter was her favorite thing. And then she broke into a spasm of pain and the nurses asked us to leave. And they said that they were going to give her a light sedative. So they did. And we were asked back into the room and she was sitting on a commode, which was ridiculous. And she was wrapped in a blanket for her privacy, but she was still sitting on a commode. And we were basically told that we should say our goodbyes. So I said to Sam, "I'm sorry, I'm so sorry." And she said, "Well, it is what it is, Mom." And I gave her a little kiss on the forehead and we were asked to leave. And then we all waited out in the hall.
Yeah.
And she was wheeled out on the gurney. She was already unconscious, and that was the visit on the commode was the last time we ever saw her awake.
Jim,
so
I can't imagine what this was like for you and Gay to go through, seeing your daughter in that state, and those are her last moments. Tell me when you decided that you wanted to launch this lawsuit and the reasons why you wanted to do so.
Okay, largely it was tied to, we've been thinking about it a long time, but I did write a complaint letter to Providence Health Care, concerned about Sam's treatment, how much, there was avoidable pain. They could have done it in the hospital, but, putting her in the transfer vehicle, I had to watch her writhe and moan in pain, and the nurse give her another shot of hydromorphone to ease the pain for that transfer. And then getting into the hospice was chaotic, had to move equipment to get access to the room. And then I get the response from Providence Health Care. And ultimately the letter states that, Sam received care in accordance with current provincial and Providence Health Care guidelines. So essentially they were saying, too bad, so sad. And so that upset us all. And then we kind of dug in deeper to look at some of the issues and the other statements that they say about how they provide compassionate care that neither prolongs dying nor hastens death. And then we dig into their policies. And what we discover is stuff that's so hypocritical and incorrect. It's upsetting. And I can't believe a faith-based organization. I'm Catholic. Sydney, Samantha went to a separate school. We get into it, and what we discover is Providence Health Care states clearly in their MAID policy that they follow the health ethics guide as their values. And in the health ethics guide, it specifically says when exercising conscientious objection, the person receiving care must not be put at risk of harm and abandonment. Providence Healthcare knew Sam was going to be hurt. I mean, that's part of why she chose MAID. She was in such pain, and they know from recent treatments the day before how excruciating the pain was, and that was a discussion with their doctor, and they did it anyway. They just didn't care. They did it anyway. And what they did do is then they required her to be fully sedated to be sent to St. John Hospice. And the upsetting part about that is there's two things. St. John Hospice is also operated by Providence Health Care, so they apply their MAID policy different there. And then secondly, the fact that she has to be fully sedated to endure that transfer forced her to confirm her consent to MAID at St. Paul's when the legislation specifically says she has the right, and all the faith-based organizations encourage them to be allowed to change their consent and withdraw it immediately before receiving MAID. So the hospital withheld, right? I mean, they denied the. So that's why we're so upset that they forced this situation.
Yeah, you're saying this is a forced transfer, and doctor, that's where I want to bring you into this conversation. Not only about the situation with Sam, but also the fact that you say that you witnessed many of these forced transfers. Tell me about that and what this was like for you to watch from a medical standpoint and also a moral standpoint.
So first of all, I want to be absolutely clear that I had no involvement with Sam's case at all. So I heard about it just like everyone else through the media. But I personally have witnessed many forced transfers, and I did 4 last week. So 3 of them were from St. Paul's and 1 was from Mount St. Joseph's. And each of them, Sam was 34 years old and she was so young. And I just admire the courage that Gay and Jim have, because it requires courage and endurance to speak through their grief and somehow make meaning of this tragedy to lose your child. But the patients I see are very similar to Sam. They may not all be 34 years old. Some are much older, some are even in their 90s, and some maybe even younger, but they're all suffering terribly. And they are all coming from an acute care hospital. They're coming from Mount St. Joseph's, or they're usually coming from St. Paul, and often from the palliative care unit. So these are patients who are already suffering unendurably, and they have to be transferred because of the religious beliefs of the institution, not of an individual. You know that nobody, no clinician is compelled to participate in MAID. They have the right of conscientious objection, while I'm a conscientious participant. This is my belief that my standard of care for these patients requires me to provide MAID at their bedside. And I'm being prevented by religious beliefs that I do not subscribe to, and given from top down by an institution that is forbidding me from providing the best possible patient-centered care.
I only have a couple.
So there are many patients.
Yeah. I only have a couple minutes left here, but I do want to get to all of you very briefly, if I could, in your reaction to this. The Health Minister, Adrian Dix, announced that they reached a deal with Providence that would allow St. Paul's patients to access MAID in a clinical space next to the hospital, but not in the hospital itself. What do you think about that solution, whether it goes far enough? Gay, I'll start with you, and then I'll go to Jim and then the doctor.
Okay. I think that anybody who is in a position like Sam was in, doesn't follow that religion, they're being persecuted for their beliefs. They're being thrown out. It doesn't really matter if she's being taken out of the building or into a love. It could have been, the Taj Mahal. It doesn't matter. She's being removed because she doesn't follow what they believe. And she didn't. And a lot of these people don't. And I know Catholics who say they would like to die by MAID if they were in Sam's position. So to be removed is just so cruel. That's how I feel. It's terrible that they've done that.
Jim?
And she should have been allowed to be in her room.
Jim, what do you make of what the province and the health minister are saying here?
Well, part of Minister Dix's mandate is accessible, cost-effective health care. And Sam's MAID process lasted 8 minutes, 8:15 to 8:23 on April the 4th, 8 minutes. When she called for an ambulance on March 12th, she waited 399 minutes. She waited from 1:24 till 8:03 before the ambulance showed up. So if you use that 8 minutes, that's 50 patients in a year, which was double what St. Paul's forced out in 2022. That 50 minutes times 50 patients times 8 minutes, that's the same 400 minutes that Sam waited for an ambulance. And he's making a purpose-built facility for 400 minutes. That's less than 7 hours.
Right.
That is all it's used for. It makes no sense. And the worst thing about it is it cannot be replicated, not replicated easily in the other facilities in BC. And this issue is across Canada. And to have that kind of irresponsible fiscal approach to what is fundamentally wrong, and it's contrary to the master agreement that says you must follow your values, and the values say they must not put them at risk of harm. It's a completely hypocritical and fiscally ridiculous approach.
Doctor, let me get you in here before I've got to let everyone go, and I wish we had more time for this conversation, but we've got to wrap it up. Your thoughts on where the province stands on this, and also what really needs to be done here so that situations like Jim and Gay's, daughter's death does not happen again.
Okay, very quickly. First of all, forced transfers have to stop across Canada. I know that some people are surprised that it's happening at all, and I think people outside British Columbia don't seem to be aware that it exists. It exists in Ontario, it exists in Toronto. Mm-hmm. So it's existing everywhere, including the capital city of Ottawa. The biggest hospital there, the palliative care hospital, does not allow MAID on site. Forced transfers are happening. So first of all, Canadians, wake up. It's happening everywhere. It should not be happening. The second thing is this workaround space that they're creating. They just have to understand that St. Paul's Hospital is currently about 10 stories high. The palliative care unit is on the 10th floor. The purpose-built space is going to be, I hear, a portable connected with a corridor, and it cannot be on Providence land, so it's adjacent to it. So this patient, if it was Sam, would still have to be moved from the 10th floor through all that, through the elevator, down, through the corridor into that room. Is that patient-centered? I don't think so. So to me, Mr. Dix really has to wake up and listen to people like us. I'm so glad that Sam's parents came forward, because we, the clinicians, have been asking him to talk to us because we've been aware of this for some time. He never listened, but he's at least listening now. So I'm express again my deep gratitude to Sam's parents.
Yeah, Jim and Gay, we appreciate your time as well. We know how difficult this is for you to talk about and relive. We're going to continue to follow this story, and Doctor, appreciate your time as well.
Thanks for sharing the story. It's very important.